I personally had to deal with a patient of colorectal carcinoma when a young cousin of mine suffered with the disease. Through an investigative process, I got to know the patient in young age with colon cancer has aggressive tendencies of the sad tumor. Unfortunately, she is in her early 30s, and all the advanced protocols have been applied to her, but in vain. The tumor is spreading day by day in all the body. This tumor needs a special kind of precautions and preventions. Even though she was completely examined just 1 year before the diagnosis of colon cancer, and she was completely alright, the doctor did not find any sign of cancer. Hey guys, for enthralling content like this, please like, share, and subscribe to our channel. Let's get started. But we can defeat colon cancer with very little effort and know how to deal with the disease. Colorectal cancer is a disease in which cells in the colon or rectum grow out of control. Sometimes it is called colon cancer for short. The colon is the large intestine or large bowel. The rectum is the passageway that connects the colon to the anus. Sometimes abnormal growth, called polyps, form in the colon or rectum. Over time, some polyps may turn into cancer. Nearly 18,000 people under the age of 50 will be diagnosed with colorectal cancer this year in the United States, said Rebecca Siegel, MPH, of the American Cancer Society. But the disease is still relatively rare, affecting far less than 1% of younger adults. Some groups have been hit by the rising trend more than others. For instance, although people of all races can develop colorectal cancer at a young age, the spike in people exit. However, black people are still more likely to get colorectal cancer at a young age than white people, even though the gap is shrinking, said Nathan Ellis, PhD, of the University of Arizona Cancer Center. The United States isn't the only country facing the alarming rise in early-onset colorectal cancer, noted Jeffrey K. Lee, MD, of Kaiser Permanente, Northern California. Similar trends have also been documented in Canada, New Zealand, Australia, and some parts of Europe and Asia. In most of these places, the number of cases in younger adults started trending upward around 1995. Experts don't know what's causing the jump in colorectal cancer among young adults, but they do know some factors that raise the risk of colorectal cancer in older adults, including obesity, physical inactivity, and smoking. Some of these risk factors have become more common over the last 45 years, along with this rise in early-onset cases, said Dashner, who helped plan the think tank. So it's possible that some of these same factors are responsible for the rise of early-onset disease, he noted. On the other hand, there may be a set of unique risk factors for colorectal cancer in younger adults that researchers haven't yet identified. Although certain genetic conditions, like Lynch syndrome and familial adenomatous polyposis, raise the risk of developing colorectal cancer at a young age, only 10% to 20% of early-onset colorectal cancers are caused by inherited factors, explained Kimi Ng, MD, of Dana-Farber Cancer Institute. When the incidence of a disease changes by generation, that suggests the culprit is something in the environment rather than something biological. Most of the discussions about the possible causes of early-onset disease converged on three interrelated factors: diet, bacteria in the gut, and inflammation. There's mounting evidence linking an unhealthy diet, in particular one high in processed meat and fat, and low in fruits and vegetables, to early-onset colorectal cancer. Likewise, several studies have found that being overweight or obese may raise someone's chance of getting early-onset colorectal cancer. Using data from electronic health records, Nathan Berger, MD of Case Comprehensive Cancer Center, found that half of younger adults with colorectal cancer were overweight and 17% were obese. Unhealthy diets have become more common in past decades, the researchers pointed out, and the number of children and adults who are overweight or obese continues to climb. In addition, people are spending more time sitting and less time being active. Studies have found that more TV time is also linked to a higher risk of early-onset colorectal cancer. Scientists have turned their focus to bacteria that live in the gut, also called the gut microbiome. Certain types of bacteria have been pegged as accomplices in the growth and spread of colorectal cancer, and some may affect how well certain cancer treatments work. Not surprisingly, gut bacteria are affected by the food and chemicals we eat, drink, and breathe. Studies have shown that diet, obesity, exercise, and some drugs, such as antibiotics, can all change the number and types of bacteria in our guts. Unhealthy diets and gut bacteria are connected in another way too. Both can lead to inflammation, the body's reaction to injury, disease, or irritation. In one study of mice, a high-fat diet triggered gut inflammation and accelerated the growth of tumors in the intestines. It is important to remember that the symptoms and signs of colorectal cancer we are discussing here are the same as those of extremely common conditions that are not cancer, such as hemorrhoids and irritable bowel syndrome. When cancer is suspected, these symptoms usually have begun recently, are severe and long-lasting, and change over time. By being alert to the symptoms or signs of colorectal cancer, it may be possible to detect the disease early, when it is most likely to be treated successfully. A change in bowel habits is observed in the patients with the early sign of the disease. One might feel the change in his bowel routine. Diarrhea, constipation, or feeling that the bowel does not empty completely, although this might be the irritable bowel syndrome, but the same signs are expected in the colorectal cancer patient. Bright red or very dark blood in the stool is the sign that there is a wound inside your intestine. So you don't have to flush your stool quickly, it's better to look down from time to time. Stools that look narrower or thinner than normal show that the inner space of the rectum is shrinking. The contraction of the inner space means something else is growing inside. Discomfort in the abdomen, including frequent gas pains, bloating, fullness, and cramps. Never underestimate it or take it lightly. Yes, most often after eating the spicy food one can feel the same condition, but in the long term the symptoms might be alarming. You might even ask your doctor to go for a colonoscopy. Weight loss with no known explanation, even in obsessive patients. The continuous loss of weight has been noticed. Never take it lightly. If you have no other such condition and you're suffering with the loss of weight, go to your physician for a complete examination. Constant tiredness or fatigue is frequently noticed in the people that have developed this tumor. If you feel muscular pain, tiredness, and fugitive, this can be one of the reasons that you're developing the tumor inside your colon or rectum. Unexplained iron deficiency anemia, which is a low number of red blood cells, is also a vital sign of the disease, especially when you have not noticed your stool color for a long time. There might be a chance of blood in the stool. So never ignore the iron deficiency. These are some major early colon cancer signs which can be measured for earlier diagnosis, but your family history is also very important. Your lineage matters a lot. If there's any patient in your matrilineal or patrilineal family, you might be at risk, although there are very minor chances for the disease, but there is a little risk in it. Your diet habits and your food selection could be very important in this term. Vegetarians, non-alcoholic, and non-smokers are at very low risk to develop the disease. So it's very much up to you to defeat colon cancer. That's all for today. Thank you for taking the time to watch the video, and remember, don't forget to subscribe to our channel for more.